With its health system on the brink of collapse, India's daily rise in coronavirus cases has remained above the 300,000 mark for a sixth straight day. Doctors fear a further peak in infections is still to come, despite medical aid starting to arrive from across the world. The World Health Organization says 3 variants of the virus are to blame for the surge of cases, along with the failure to control large gatherings. Our South Asia correspondent Rajini Vaidyanathan reports.
A collective loss that's hard to process as the pyres keep burning. There's a tragic inevitability in India, because tomorrow these scenes will be the same. Round the clock, volunteers like Jitendra Singh Shanti have been helping to cremate those who've died.
50% of deaths are not registered by the government as COVID-19. Our NGO brings bodies to be cremated directly from homes of victims. The government only counts related deaths of victims who die in a hospital.
He believes the actual death toll is far higher than the official numbers. And in a country dubbed the pharmacy of the world because it produces so many medicines, there isn't enough to go around. Police guard the limited supplies. Families forced to wait for whatever they can. Many feel abandoned by those in power.
The government has failed us so much that those who can normally survive would also die. So many people are dying because they are unable to get the most basic services. This kind of disaster I'm witnessing, I've never seen this level of crisis before.
And in this crisis, help from further afield. Ventilators and oxygen concentrators sent by the UK government arrived in Delhi last night. It's a start, but with the surging cases, nothing is enough. There's also been offers of help from other countries too. Even regional rivals like China and Pakistan have pledged support. The US is also looking at supplying oxygen, COVID tests and PPE to India. It's also announced it'll share up to 60 million doses of the AstraZeneca vaccine with other countries as they become available. But for so many families, it's all too late. No cry for help can save what India has already lost. As thousands die every day, more families bear the pain. And they're not alone in their grief. India is a nation in mourning. Rajini Vaidyanathan, BBC News.
Well, I'm joined now by Professor Srinath Reddy, President of the Public Health Foundation in India in Delhi. Sir, thank you so much for joining us here on the programme. We've been seeing some pretty desperate and grim images coming out of India for the past week. Supplies from the international community are also starting to arrive, but is it enough?
Well, obviously, it's not going to be enough. The supplies are going to be helpful. It's a wonderful gesture of friendship and support. But we need to get our own act together in terms of ensuring oxygen supplies, not only to the big cities, but to the smaller towns where the situation will become problematic if the pandemic spreads there fast. But all help is welcome at this point in time. The government officials say that as far as oxygen is concerned, there is no actual shortage of production in the country. It's a question of switching over from industrial use to medical use, and also overcoming some of the transport issues between the points of production to the big cities that are some distance away. But nevertheless, for the next few days, we are going to be seeing these challenges continue, and we need to quickly overcome them with concerted action.
Is that being done, in your opinion, quick enough? Because I've also been hearing that in terms of oxygen, there isn't a shortage, it's just getting it out to the people.
Yes, indeed. That's the problem, because firstly, I think the production sites had moved entirely into prioritizing industrial usage. But now the transport system, even packing it into cylinders for transport, all of that has actually cost time. So we do need to speed up that process as fast as possible. And now different methods of transport are being used, including airlifting. So I think some of the areas which are particularly challenged need to be assisted faster than others.
Do you also think that your vaccine program needs to be sped up as well?
Well, as far as our vaccine program is concerned, it was going at a relatively slow pace because I believe that this particular surge and the second wave was not truly anticipated. It was thought that the two vaccines which were already given regulatory approval and were under production in India would suffice to meet the demands till May, June, while we were actually vaccinating people who are considered to be in the vulnerable age group or had some additional health problems or considered essential workers. And by then, other vaccines would have been in production and would have been available. But that plan actually became infructuous when the pandemic actually came back in ferocity. And now the urgency to vaccinate as many people as possible, as fast as possible, is a task that we need to undertake. And unfortunately, the supply chain is at the moment narrow, but it's being expanded as fast as possible. But certainly the vaccine situation also is something that could have been better if the second wave was anticipated.
And just briefly, I mean, do you think a solution to this is another national lockdown?
Well, actually, there won't be a national lockdown because the severity of the wave is varying across states. The calendars are somewhat different. Some of the states which actually had the severest outbreaks in the initial stage are now showing some degree of decline in the rate of rise of deaths, whereas, as well as cases, whereas others are now entering into that phase. So we'll have to actually adopt a state-specific strategy, even possibly a district-specific strategy, but it has to be a nationally coordinated effort. So what we need is a countrywide coordinated containment strategy rather than an omnibus strategy of lockdown nationally all at once.
Professor Srinath Reddy, thank you very much for joining us here on the programme.
Most welcome.